Today, the nation observes the National Foetal Alcohol Syndrome Day. The day aims to reinforce messages about the risk of drinking alcohol during pregnancy and also to encourage any prevention of fetal alcohol syndrome disease. Research suggests that South Africa has the highest prevalence of fetal alcohol spectrum disorder, FASD, in the world, which is more than 14 times the global average. Action for Alcohol-Related Research is the leading NGO source of the research and information on fetal alcohol spectrum disorders and the most severe form of this disorder, namely fetal alcohol syndrome in South Africa. We talk now to Dr. Leane Olivier. She is the Chief Executive Officer at the Foundation for Alcohol-Related Research, and she joins me now live via Zoom. Doc, good afternoon to you. Thank you so much for joining us here on the SABC News channel.
Thank you for having me on your program.
So let's just first get an understanding of this fetal alcohol syndrome, because we also know there is what we call fetal alcohol spectrum disorders. What's the difference between the two?
Yes, it can be very confusing, but if we remember that fetal alcohol spectrum disorders, or FASD, is like an umbrella term for a group of conditions or different groups of conditions. And one of the most known conditions is fetal alcohol syndrome. And as you correctly said, some people refer to it as the worst form of the condition. There are other types of conditions, but it makes it very complex to go into that. So let's rather stick to fetal alcohol syndrome to make it simple. It is caused by when a baby is exposed to alcohol during pregnancy. In other words, if a woman drinks alcohol during pregnancy. And the big danger in South Africa, or problem in South Africa, is that about 78% of pregnancies, that's across the board, is unplanned. So quite often women use alcohol without knowing that they are pregnant and then unintentionally put their babies at risk.
How much is enough alcohol or too much alcohol for a pregnant woman? Are we totally not supposed to take alcohol when pregnant?
That's a question that's often asked, and research both in South Africa and internationally indicates that no alcohol is safe during pregnancy. We must keep in mind that the alcohol has got like a poisoning effect on the developing organs of the baby, so any organ can be affected and the damage is permanent. And because the brain starts developing soon after conception and right through pregnancy, the brain is the most vulnerable organ. So a person born with fetal alcohol syndrome has always got some form of brain damage, which we see as the child grows older. We see it as developmental delays, learning disabilities, of course, with numerous problems at school, which might lead to early drop out of school, behavior problems, etc. We always talk about children with FASD or fetal alcohol syndrome, but because it's a lifelong condition, we also need to keep in mind that we also have adults with fetal alcohol syndrome, and it's a very difficult life that they lead. Quite often, they cannot function independently, so they need their family to support them as well.
All right, so as you say that about 70% of pregnancies in the country are unplanned, and in most cases, women are not even aware when they're pregnant. The effects of alcohol intake during pregnancy, can they be reversible? I mean, if I'm pregnant and I wasn't aware and had been taking alcohol for quite some time now, will I be able to reverse the effect that alcohol may have on my baby?
The damage caused by fetal alcohol syndrome and by the alcohol that you take while you're pregnant is irreversible. But we always say to people, and it's sad if somebody hears this for the very first time, if you're pregnant and you're using alcohol, it's never too late to stop drinking, because then immediately you can stop the harmful effects of the alcohol. Also, it's not necessarily a doom and gloom picture, because it is important for people who are worried about their children to get the children assessed and examined by a clinic or private doctor as soon as possible, so that you can see what you're dealing with, and that you can also reach out to organizations like ours for support and guidance on how to manage your child. Because the parents, the caregivers of the children, need a lot of guidance and a lot of support, because it is quite often a lonely journey that they are on, especially in areas where there are very, very little resources for these individuals.
Quite an interesting piece that I read earlier, because we understand that since 1997, your foundation has been dedicated to building positive futures in South African communities by trying to reduce birth defects and mental disabilities that are caused by this alcohol consumption during pregnancy. And yet we still have the highest prevalence of fetal alcohol spectrum disorder in the world. What and where is the problem? Do we not know, as you said earlier, that almost everyone should know? It's a common knowledge. It's known. It's out there that we're not supposed to take alcohol when pregnant. But what's the problem? Why are we still sitting with this high prevalence of this problem in the country?
Yes, like you correctly said, we started doing this work, the research work, in 1997 already. Our organization is also doing extensive awareness and prevention work, and also training nationally, training specifically of social workers, educators, and health professionals across the board, because we need all hands on deck to help us to address this problem and prevent children from being born with fetal alcohol syndrome. But the reality is that we constantly, daily meet people who say to us, I did not know about the harmful effects. I did not know about fetal alcohol spectrum disorders or fetal alcohol syndrome. And also we get a lot of people who are very, very judgmental and keep on blaming women. And in our research, we found that women are not drinking intentionally. If we speak to women, and of course in a very non-judgmental way, and ask, why did you use alcohol during pregnancy? Firstly, women would most probably say we didn't know. Secondly, we experienced severe stress, and that was a way of coping. And then sadly, we were under pressure of our partners, family members, or friends who said, 1 or 2 glasses of alcohol per sitting surely can't do harm. All the wrong information. And then also another problem is quite often women get mixed messages from their health professionals. So again, the message is no, alcohol is safe during pregnancy, but it's not only the woman's responsibility. We need to, as a society, stand together and help women of childbearing age to have safe alcohol-free pregnancies. And that's why we're having events like today, which is International Fetal Alcohol Spectrum Disorder Day, to raise awareness about this.
And I believe nothing, Doc, should justify alcohol intake by pregnant women. So we've seen the provinces of the Western Cape and the Northern Cape with the highest prevalence, which of course one can argue to say it's not that much of a surprise, especially when one looks at the Northern Cape due to its highest rate of alcohol intake in South Africa.
Yes, our prevalence rates in South Africa, like you correctly stated, is the highest in the world. The World Health Organization estimate, and that is based on systematic reviews and very careful research, that worldwide the FASD prevalence rate is approximately 1.5%. Now, in our country, and that's based on the research that we've done in the Western Cape, Eastern Cape, Northern Cape, Free State, and Gauteng, we've got communities where the rates range from 2.7% to as high as 28%. So 28% of the population in certain communities that have fetal alcohol spectrum disorder, and that is in fact 14 times higher than the average in the rest of the world. So indeed, our country has got a very big problem with FASD.
All right, time constraints, I'm afraid, but we thank you so much for taking the time.
Welcome. Thank you.
Baie dankie. Dr. Leane Olivier is the Chief Executive Officer at the Foundation for Alcohol-Related Research, talking to us about the day today being what we call the National Fetal Alcohol Syndrome Day. This is really to reinforce messages about the risk of drinking alcohol during pregnancy.